Today we are very honored, very thankful to have Dean Nicholas Hancock
Thank
in
you.
our first episode. Yeah, so Dean Nick, could you like to shortly introduce yourself?
Sure, of course. I'm our Associate Dean here at Five Branches University. I'm also a licensed practitioner of traditional Chinese medicine. I'm also a teacher of traditional Chinese martial arts and just somebody that loves and gets a lot out of Chinese culture and traditional arts. Living here in California, in Central California, I'm primarily reside in Santa Cruz. So we have two campuses at Five Branches University. I primarily work out of Santa Cruz, but today I'm here in San Jose. I'm happy to be here for our podcast on our first episode, and also to get ready for the Chinese New Year.
Yeah.
So I think it's a perfect timing to help educate everybody about what Chinese medicine has to offer, and why really everyone should be interested in Chinese medicine.
Nice, yeah. And as you mentioned, you were born in California, right?
Actually, I was born in Washington State.
Washington. Oh,
yes,
okay,
I was born in Washington State,
Yeah.
and emigrated here to California to study Chinese medicine because I had a background. I was doing biochemical engineering for a few years in my undergrad, had a really strong hard science background, almost like a pre-med. But as I progressed in my education, I realized I really wanted to focus on a field that I felt would be innovative, that would be able to change things about the healthcare system or our scientific models, help bring new understanding to people and change their lives.
Yeah.
So I made a change in my educational trajectory, and at the end of my undergrad career, ended up finishing my degree in history and philosophy of science, which ended up bridging perfectly towards traditional Chinese medicine. So I spent about 2 years actually traveling around the country, looking at different Chinese medicine schools. And I went to the East Coast. The only place I didn't go was Hawaii, just because the plane ticket's a little too much at that time. I was still a student. But I looked at all the major schools, and I knew what I wanted was a school that would actually have the culture of Chinese medicine at the school.
Right.
Because I felt, to me, the main goal was just to become the best practitioner I could, to be able to help as many people as I could, to really go deep in my study of Chinese medicine. So I assumed, and it ended up being a good assumption, if I went somewhere there was a strong Chinese culture surrounding the medicine, that I would find people there that would actually be able to transmit the medicine, the living medicine, from its ancient tradition. You know, that's what I was looking for as a student. And so when I came and visited Five Branches, I felt, yeah, this is a good place to actually learn Chinese medicine because of the strong Chinese culture. Now, I had a unique advantage, because I'd been studying Chinese martial arts before I learned Chinese medicine, and had a really outstanding shifu. Her name is Debbie Leong, and she was in Olympia, Washington. I studied with her for about 2.5 years, learning Lian Gong Shi Ba Fa and Wu style Tai Chi Chuan, and she had excellent lineages from Wen Mei Yu, and also from Master Su Zifang. So I had this kind of outstanding experience, being able to really go deep in the study of traditional Chinese martial arts. And what was impressed on me was how important the culture was in the learning process, that you couldn't separate those things. You couldn't separate traditional Chinese culture and the wisdom in that culture from these art forms. And my shifu, she had encouraged me, you should really think about studying Chinese medicine, because you have this science background, you know, and what you want to do is something that is kind of on a frontier that has a lot of potential to change the world. You should check out Chinese medicine. And so I credit her for sending me in that direction. Ended up being a really life-changing, abundant opportunity to enter this career field. I couldn't be happier. So originally I'm from Olympia, Washington. But that's how I ended up here in California, was because it was here that I felt like, for me, it was the right place to learn Chinese medicine.
Yeah, nice. So based on your experience, did you find, like, because you mentioned you get to know the Chinese medicine through Chinese Kung Fu, right?
Mm-hmm.
And did you find any like a connection or relationship between these two?
Oh my gosh. The short answer is absolutely yes.
Yeah.
Like so strong. Actually, what I found, I got into Chinese Kung Fu because I needed to heal my own body. I was an athlete as a young person, and I was a highly competitive athlete. So I trained. I was in the weight room every day. My dad's also has a really strong athletic background in my family. He had started bringing me to the gym when I was like 12 years old, as soon as I could go. So I was push-ups, pull-ups, weight machines, stretching, everything. But all based on the kind of modern Western sports science ideas. So because I was somebody that was kind of like really almost aggressive with their training, really enjoyed training really hard, what ended up happening to me was by the time I was 18, 19 years old, I had a lot of pain through my whole body. I had neck pain, back pain, shoulder pain, hip pain. I mean, you name a joint, I had pain in it. And I was only 18 or 19 years old. So I intuitively felt there's something not right with that situation. How am I gonna age? What's gonna happen to me? And athletic trainers or orthopedic specialists, they kind of indicated, if you continue weightlifting like this, because that was my sport, was competitive powerlifting. If you continue doing this, for sure you're going to have joint problems in the future. And there are solutions for that, but they'll include surgical interventions, or maybe the use of pharmaceutical drugs to treat the pain. And none of those ideas I was interested in. So I started doing research to figure out, what is a sport, or what is a kind of a physical culture that I could get myself invested in that would actually heal my body instead of continue to break it down. And so I just, at that time, this would have been in the mid to early 2000s, like in 2005, 2006. There were still bookstores. This was like before everybody just got things on Amazon, got all their books on Amazon. You could go to used bookstores and just spend a whole day finding out information you had no idea about. So I would go to local bookstores, and I found all these books on Qigong. I found all these books on Kung Fu. I found all these books on different ways to take care of your body. At that time, my search and my field was very broad. So I was researching everything from like an Indian yogic tradition, Chinese medicine, Qigong, Chinese martial arts, Indian club swinging, traditional forms. I felt like the traditional wisdom, something I was just drawn to it. If people have been able to do this for thousands of years and it's still working, then maybe I should look there, So I started doing research. I started seeing if there was anyone in my local area who taught these things. And that's how I found Shifu Debbie Leong, and she was teaching Lianggang Shi Ba Fa, which ended up being perfect match for me. That's like a system of Qigong that's intended to open all the joints of the body, and it's developed by an orthopedist, a traditional Chinese medical orthopedist, combining other styles of Qigong, Baduan Jin, Yi Jin Jing, Hua Tou's 5 animals, Frolics, into a kind of a modern system of Qigong, specifically to heal your joints. So that's how I found that. And then what I discovered was the most basic, simplest practices in Kung Fu, they had profound effects for my health, for my well-being. Again, I had pain in almost every joint, but after I practiced for just like 1 year and pretty consistently, I tried to really practice every day. I took my Shifu's training very seriously at that time. Train every day for 1 year. It was like I had a new body. All the pain's gone, range of motion restored. Even I was shocked to find that my strength increased from doing like very slow, relaxing movements. It blew my mind at the time, but now I understand how and why. But I was so shocked at these outcomes.
Could you be more like because I know a lot of our audience, they probably don't know Chinese medicine, right?
Yeah.
So could you like first like talk about what is Chinese medicine, and then compare your previous like weightlifting practice with like a Chinese Kung Fu. What's the difference? So what's the Chinese medicine to you?
Yeah. Well, I mean, it's a huge question.
Yeah.
Right? But Chinese medicine to me, first to answer that question, what is a Chinese medicine? Well, Chinese medicine is a complete system of medicine, natural healing, self kind of healing, natural healing practices that spans everything from diet, massage. People have heard about acupuncture, people have heard about herbal medicine, but Chinese medicine also includes things like learning to live with the seasons, even something as simple as like how to organize your day. What are the appropriate activities based on time of day to really maximize different potentials that we have naturally in relationship with our environment. So Chinese medicine is huge. It's a huge field. Those are the modalities, kind of what I just mentioned. Those are the modalities. But actually, it's a tradition. Chinese medicine is a tradition that is an indigenous tradition in China and East Asia. I mean, we're saying Chinese medicine, but the culture of this medicine is actually one that comes and is spread through virtually all of East Asia. And it's ancient. It's indigenous. You could say its roots are even prehistoric, right? I mean, our modern textbooks today, many of them contain quotes that come from books like the Huangdi Neijing. This is the Yellow Emperor's classic of medicine. That book is conservatively like around 2,000 years old, but even at that time, that book was completely formed as indicating there's a complete system already formed at that time. Means the tradition of the medicine, it's almost impossible to tell actually how old it is.
And then because as you know, we are located in the Silicon Valley, San Jose, right? And from your point of view and your experience, why this ancient 1,000 years old book and all knowledge can apply to the modern world?
Oh, it's again a really good question. This is something I think about all the time. I think modern people, and you mentioned Silicon Valley, but it's everywhere. Information technology, modern lifestyle, people spending more time in front of screens than ever. This is good. This modern technology is good and has provided a lot of advancements and made things much more efficient worldwide, right? But it has a tendency to kind of isolate us in our experience as human beings. It has a tendency to isolate us and separate us from our natural environment, or even separate us from ourselves, our own feelings. Chinese medicine, it's like one of its main points and one of its strongest points is that it is based on and effective because we're human beings. It's based on our humanity. The human being in this model, not separate from nature. Human being is a part of nature in this model. That's assumed in Chinese medicine. So many of the views, many of the practices, many of the prescriptions in Chinese medicine, all they're doing is reintegrating the individual with their experience in their environment, in their community. Today, this is something so valuable, seems so simple, and really you can say it is simple, but especially for people in the modern world in a place like Silicon Valley, these are simple, ancient ideas, really necessary, really effective to help them optimize their experience, to help them integrate their experience, to get to know themselves better, to live in a way that is more healthy. It's really incredible. I think it's actually the fact that Chinese medicine is so ancient is actually part of its value today. I mean, there's a lot of different ways, things we can talk about related to that. Another thing I want to say on that same topic is, because it's based on ancient ideas. It's also kind of challenging to modern scientific models. Try and understand how this is so effective. Cannot exactly pinpoint how and why it's so effective. To my mind, that's why it's exciting, is because Chinese medicine is actually pointing at gaps in our current understanding. That means it could stimulate new understanding. It could stimulate developments that would actually help us refine our current models. So that's something that I think the potential for Chinese medicine to do that in the healthcare field and in just the broader field of science is just at a beginning point where more people are starting to understand and get interested. So where we still have a lot of potential to impact the world that we're in, simply because it is so ancient. Actually, it's very interesting.
And I also noticed like the way we treating or the asking patients question is different, right?
Yes. It's fundamentally different. And this goes back to the point that I made previously. With a Chinese medicine practitioner, when the patient comes in, first question we ask are questions like how you feel, how's your energy level, how's your sleep, how's your bowel movement, what's your diet like, tell me about the quality of your pain, what you're experiencing. This is already really different from the current Western allopathic model of medicine, where the information that is medically relevant, usually it's data or information that is the doctor or the expert. They're the ones who have access to, who understand, who interpret this data. And then they're giving the patient the prescription. They're giving the patient suggestion. But in Chinese medicine, from the very beginning, it's the patient's experience. It's the relationship with the patient. It's the rapport with the patient that's developed that is actually the basis for the interaction between practitioner and patient. So there's like
I remember, for example, if we see some that people have a low back pain, we even ask, what's your energy, what's your emotion, what's your diet, what's your appetite?
Yes.
A lot of questions.
Yes.
They are all related, right?
That's right. It's related in the experience of that person. And that's why, I think that's why Chinese medicine still works today. You could ask the question like how is it? It's still working, even though maybe our lifestyle is so different, or even we are not in ancient China today. We are in California. We're in Silicon Valley in 2026. But this medicine is still so effective to give outcomes for patients in our teaching clinics. We have hundreds and hundreds of patients coming in and out, all getting good outcomes. How is that the case if its ideas it's coming from such ancient time? Actually, because the medicine is based again on us being human beings. The fact of the matter is we're still human beings today, and we were human beings then too. In the future, hopefully we're still human beings, right? As long as there's human beings, Chinese medicine's effective. It doesn't matter where you're from or when you're living or what your ideas are, your views. It's just simply based on, again, like observation of nature, observation simply of how the human body's organized. That is common. So because that is common, it's just still effective. To me, that's like a mind-blowing point about Chinese medicine that I'm constantly talking about with my students when I teach. I think it's a unique strong point of Chinese medicine. It's based on our humanity.
And you brought up very good points. Like I feel that sometimes, a lot of time we observe this season, we observe patients' lifestyle, and it's like a preventive medicine, right? You can notice like before the symptom shows up, right?
That's right. Because we're asking usually. the person has a feeling first,
right,
and they feel something's off. They have headache, maybe their appetite's low, their energy's low, their sleep is not deep. If they go in and they do, diagnostic testing, they get blood work done, X-ray, all different kinds of imaging and lab testing, may find something, but may not find something.
Right.
Then, the doctor will suggest, okay, there's you can try maybe some tea, some I don't know.
Or just exercise.
Try, right? And but that's not the strong point of Western medicine at that point. Before something has been found. For sure, after something is identified with the diagnostic testing, that is Western medicine's strong point. But Chinese medicine's strong point is actually before something has formed in the body, before there's been some change that you might be able to see. So that also, I think especially today, people are more interested than ever in preventative modalities, right? So again, you're also making a very good point there. That's I think is when Chinese medicine is the most effective. That's in the preventative phase, actually.
And we not only give the medicine, we give like the lifestyle situation, do qigong or change the diet or something like that.
Stretching. I mean, it could be anything really. Again, that's the beauty of Chinese medicine is it's addressing the whole scope of the human experience. I mean, if you wanted to get esoteric or kind of on the fringe of what we might consider Chinese medicine, but you look at the record in the ancient past, even things like a feng shui, this also considered relevant medically, or even like the calendar, the patient's time and day of birth. This information was relevant to the Chinese medicine doctor. So
we look in the energy.
Yes, exactly. So that's something also very interesting about Chinese medicine is because it's the scope of the culture is also so broad. It interfaces with all these other traditional art forms that can really help people have different experience of their life holistically. So the medicine is when we say holistic medicine, right?
That's right.
In Chinese medicine, we actually mean that point very seriously. Holistic meaning, could it be anything to do in your life? And the Chinese medicine doctor, that's why they develop rapport. They listen to the patient and they ask so many different questions, try and understand what are all the different factors coming together, having this outcome patient is saying is their chief complaint, whether they have a headache, a low back pain, whatever it is. Chinese medicine doctors really interested in all the different factors, even things like the weather, right? I mean, when you study Chinese medicine, that's one of the first major topics we discuss is how different weather conditions affect people's health status. It goes back to your original question, what is Chinese medicine? I mean, it's huge.
Preventive, and the lifestyle, everything,
Yes, a lot that we could talk about there.
And then when we talk about like the question we ask the patient, and then in the clinic sometimes I notice a lot of these questions, the patient haven't think about these questions. They are just busy with their life. They are not care about themselves. But while we asking, they train them to be more mindful. Observe their body, observe their energy.
That's part of the treatment right there. I mean, that's where the treatment, the quote unquote treatment actually begins. Is as soon as the patient and practitioner meet. So it could even be, I mean, this is something I talk with my students about all the time. And we know human contact, we know that social interaction can have therapeutic benefits for people. So for the Chinese medicine practitioner, this also really important that they develop themselves in a way, mindfully develop themselves, so that the impact they have on the people that they interact with is a positive one, is a therapeutic one, is a beneficial one, even from the way they shake the patient's hand, the way they guide the patient back to the room. Then they start asking patient questions, and even the way that they ask the question makes the patient go,
yeah,
oh my gosh, you're right, I hadn't realized, but actually when you asked me that, I remember at that time that did happen. That was when this symptom started. Oh.
Yeah.
Then leads to something like acupuncture, herbal medicine, massage, to some modality. But actually the treatment began then, when the patient and the practitioner are interacting.
Exactly. Yeah, that's right. Yeah. And yesterday in my class, one of the teacher mentioned, as a Chinese doctor, we are not only the Chinese medicine doctor, we are also like psychologists, and also we are also priests.
Yeah, our it's outside the legal scope.
Yeah.
But actually, we do need to develop ourselves in these kind of ways.
Yeah.
Because again, going back to the scope of the medicine, the culture of the medicine is as big as human experience itself. So I mean, any medical professional has this experience. Even like a massage therapist, or I would even go so far as to say even outside, anyone that works with people, even hairdresser, even like the nail tech, working with people, you get so much information and you have so many opportunities to have a positive impact. For the Chinese medicine doctor, we take that very seriously, actually. Because also Chinese medicine is talking about things that maybe it's in a future podcast, maybe we talk about yin and yang, right?
Yeah.
But just to touch on that very briefly, part of the way we understand things is there's always a known component, what I can see, what I can measure, what I can say, this table looks like table, this microphone's microphone, I'm wearing jacket. Those are the known things. There's also an unknown component.
Right.
So Chinese medicine accepts known and unknown, and wants to use known and unknown. So that means sometimes something very subtle actually may have big impact. We also want to use that as a tool. Those subtle things, even parts that we're only liminally aware of, or even in our unconscious parts. This also we want to develop as a tool.
Right. Yeah. And we not only look at that, we are looking at the balance, right?
Yes. Yeah. That's a major theme. Balance, harmony.
Yeah.
Like a kind of dynamic ability to interact, but maintain in a kind of state of harmony.
Yeah. And to go back to the first your answer, like you start with powerlifting, right?
Yeah.
So and then you switch to Kung Fu.
Yes.
And you think it's like when you are doing Kung Fu, you also try to find the balance between this known and unknown.
Yes, exactly. So practices like Kung Fu or Qigong or many other traditional art forms. I mean, I would say even like a calligraphy or even flower arranging has this same capacity, this same quality of balancing and kind of working with the known and unknown components to get some kind of effect. My experience with weightlifting was it was kind of the opposite view. It was like there was new ideas about training methods, make sure your recovery period, your nutrition, but we kind of overemphasize certain points, and then the other points we didn't pay any attention to at all. For example, this was a long time ago. I'm sure that this is not the way that people are training today, but in the powerlifting community I was in, I was discouraged from stretching. because they say, well, for powerlifting, actually your muscle very tight, make it more strong. So if you start stretching, it might make you actually weaker to do stretching and mobility. Yes, because we're just focused on the maximum tension of the muscle.
Yeah.
So, you know, I was young and impressionable, and I wanted to perform in that arena. So I took the advice I got from my coaches and from my trainer very seriously at that time. But actually, ironically, that's exactly what led to my pain. That's what led to limited range of motion, led to my concern, which ultimately led me out of that sport, out of that way of training. And interestingly enough, then as I continue to develop myself as a traditional Chinese martial arts practitioner, Kung Fu practitioner, then I find actually inside Kung Fu, there is resistance training there too. They also do resistance training, but different way to do resistance training. So then it kind of like
to be
really
more specific, what's the different way?
Well, like in Kung Fu, one of our like main principles, we're always trying to use our whole body.
Yeah.
So even though something like the punch or kick or maybe a throwing or grappling, it appears that the action is happening in a specific limited space, but actually the kinetic force and the control for this action, I'm trying to draw from my whole body. If something happening in my hand actually is coming all the way from the tips of my toes and my feet. And this might depend a lot on exactly how my spine is sitting, the level of my pelvis, are my shoulders dropped, my elbows dropped, even my breathing, or even my mind, to have an effect that seems like, oh, it's punch comes from your hand, punch comes from your arm. No, in Kung Fu, no. This punch is your whole body. Punch is even your mind doing the punch, even your breathing involved in the punch. So apply that same idea to something like a resistance training. So suddenly we're not isolating one joint and I'm doing my bicep curl, I'm just holding my shoulder tight, trying to only flex on my butt. Actually, this same kind of motion, well, what if I do integrate my spine? What if I do twist? What if I do press out from my leg, connect this force in my arm, make it actually my whole body? Then I find my arm is not getting exhausted. I don't have like an elbow pain. Actually, after I do this kind of training, I don't feel like tight. Very interesting. And actually, maybe if I continue training this way, I find I'm actually stronger.
And not only your body, the way you are breathing, your mind, your focus, they are all related.
That means the outcome from the exercise also could potentially be much broader. So instead of just thinking I'm doing the exercise of just my bicep, just my arm, what about my organs? What about all my other tissue? What about my blood flow? What about my nervous system? How all these things are connected, how they're all related. Could I take some very simple practice, but actually use that simple practice to affect all those things simultaneously? That's one of the major differences I found. But there's so many. I mean, you're a martial artist yourself, an accomplished one, so you know very well. That's a whole other discussion, the culture and sports science and huge history and tradition of Chinese martial arts is equally as vast as Chinese medicine, overlapping considerably, extensively.
That's true. So I think we are almost run out of the time. So so if you want to give like one takeaway to our audience, what would they be?
One of the ideas that's kind of been woven through all of our different discussions today, introducing the podcast, introducing Chinese medicine, helping people understand how and why it's important today and can help everybody. The main point is Chinese medicine's efficacy, its effect, is based on integrating people with their own experience, with their own experience, with their environments, their internal environment, their external environment. It's something that is actually Chinese medicine is something that comes from inside.
Inside, yeah, good point. Inside, yeah. So when we like treating the patient or something, or basically like we are treating from the inside.
Yes, the treatment, even the treatment, sounds like doctors doing the treatment to the patient. That's how it sounds especially when you say it like in English, as giving the treatment. But actually, what the doctor is doing is helping the patient reorganize it themselves. To connect with themselves. And I think we can talk this in the future episode. For example, when we are receiving the acupuncture, right? Basically, the patient is using their internal system, their internal qi, to restore the balance. Not totally rely on the just needle something. Right, it's coming from inside them, their own healing.
All right, thank you.
Of course. Thank you, Hugo.
So if you like our channel, so please follow. And we have a lot of good episodes to discuss in the future. So stay tuned. Thank you.
Thank you.